Hi, this video is the RF hair transplant restoration surgery on a client who actually has thinning from the front all the way toward the back. He's a class 4-5 hair loss pattern. And if you can look down a little bit for me so the audience can see, there we go. And look up. And so basically he had a procedure done before and 2,700 grafts, 2,700 grafts to cover the front part. There are some growth, but the density is not there. So his hair is a little bit wavy and curly. There's a big difference when it comes to hair transplant or hair restoration when you compare the straight hair versus the curly hair and the wavy hair. The curly hair is a lot more difficult, and of course the most difficult is the black African curly hair. This client, he's from different descent, however his hair is pretty wavy and curly, and there's quite a bit of different technique how you harvest the hair graft, how you dissect the hair graft, and how you transplant the hair graft will ensure the better result in density. So for this client, we're going to be attempting at least 4,500 grafts. I'm very excited for him because I feel very confident that we're going to give him an excellent coverage from the front to the back. He's already a good looking guy, and once you frame the hairline more and lower the hairline, not really lower the hairline, his hairline is there, frame the hairline, give it more density, it really bring proportional to his overall face, and a third, and a third, and a third. And when you do that, it really enhances the eyes, the nose, and all the features that God created. And he will gain at least 10 to 20 years of his youth back. The important factor is hair transplant is not just the surgical skill. The surgical skill will determine the density, the artistic and aesthetic detail to ensure a very natural result. And so, again, from the mid eyebrow to the hairline on Caucasians around 7.5 to 8.5 centimeter, and for this client, he's naturally is around 8 centimeter. That's his natural hairline, and so we're not going to change much of it. And the shape is there, so we're not going to change it. Once you get the shape down, we dance the up and down the hairline, and that's called the zigzag. There's two types of hairline. Actually, the soft hairline doesn't have the bigger zigzag, and we'll put a lot more single hair roots in the front, so allow the hairline to look soft. And then the tighter hairline is a smaller zigzag. So it's a good and bad in both, and I'll tell you quite a bit of celebrity more out for this tight hairline. Why? Because it brings more of a wow factor. It gives you a sharper hairline and a more dense look. Because a bigger zigzag, it'll give you a softer hairline, however less dense look, just from the frontal point of view. Or you can go somewhere in between, and that's natural and that's important. And so you can always convey that to the surgeon, and we can always do that. Once we get that down, we transplant at a very precise angle at 35-45 in the front. Changes when you go a different direction. And not only precise angle is important, selection of hair graft is important. We transplant rows and rows single hair graft in the front, followed by root to go 2 here, 3 here, and 4 here in the back for bulk and volume. So since he lived pretty close to me, we're going to try to do a year follow-up, so the audience can tell the difference for his hair. So maybe by then I can convince him to let me show the full face. Until now, we got to give him an excellent result first, and that will be an incentive for the audience to see. Thank you.